HIPAA is the single biggest reason clinicians give for not using AI tools in their practice. And honestly, that concern is legitimate, but it's also frequently misapplied, and it's keeping a lot of clinicians away from tools that could save them hours every week. Today, I'm going to give you a clear, practical framework for using ChatGPT and similar AI tools in your clinical workflow, legally and safely. Let me start with the most important thing to understand. HIPAA applies to protected health information. It doesn't apply to everything you do as a clinician. This is where most of the confusion comes from. What you can use ChatGPT for without any HIPAA concerns. Number 1. Clinical education and reference. Asking ChatGPT to explain the mechanism of action of a medication, review treatment guidelines for a condition, or summarize current evidence on a clinical question. None of this involves patient data. You're using it like a very good medical textbook. Zero HIPAA risk. Number 2. Template and protocol drafting. If you're building a new patient intake form, writing a practice policy, or creating a staff training document, ChatGPT is an excellent drafting tool. No patient data involved. Number 3. Writing and communication assistance. Drafting a letter to an insurance company, writing a referral template, improving the language in a patient education handout. All completely acceptable with standard ChatGPT. Number 4. De-identified cases. If you remove all 18 HIPAA identifiers, name, date of birth, specific dates, geographic data smaller than state, and so on, and you're using a hypothetical or fully de-identified case for educational purposes, that is not PHI. Some clinicians use this approach for complex case analysis, though it requires careful de-identification. What you cannot do with standard consumer ChatGPT, you cannot enter actual patient data, names, dates of birth, MRIs, specific diagnoses tied to a real patient, into the standard free or plus version of ChatGPT. OpenAI's standard service does not have a business associate agreement, which means it's not a covered HIPAA-compliant service for PHI. But here's where it gets more nuanced. OpenAI offers enterprise and API tiers where BAAs are available. ChatGPT for enterprise, ChatGPT team for small teams, and the API all offer BAAs under certain conditions. If you're building a healthcare workflow that processes PHI, you can use these tiers, but you need to sign the BAA first, configure data processing appropriately, and understand the terms. The practical workflow. For most clinicians, the safest and most efficient approach is this. Use standard ChatGPT for everything that doesn't involve patient data, education, templates, writing, protocols, and use a purpose-built HIPAA-compliant AI scribe tool for documentation. Don't try to repurpose ChatGPT for real-time documentation when there are purpose-built ambient scribe tools that already have HIPAA compliance built in, include BAAs, and are designed specifically for clinical encounters. That's not what ChatGPT is optimized for in any way. One more practical tip. If you work for a health system, check whether your organization has an enterprise AI agreement already in place. Many academic medical centers and large health systems now have Microsoft 365 Copilot agreements or ChatGPT Enterprise Access available to staff. You might already have access to a compliant tool through your employer without knowing it. The bottom line: HIPAA shouldn't be a reason to avoid AI entirely. It should be a guide to using it correctly. Use AI freely for tasks that don't involve patient data. Use compliant tools when PHI is involved. Sign BAAs before processing patient information with any third-party service. I've put together a plain language checklist in the description below that you can use to evaluate any AI tool against these criteria before adopting it in your practice. If you found this helpful, subscribe. We break down AI tools for healthcare professionals every week without the vendor hype.